In the third part, we will talk why we need to do this cohort study and the advantage and disadvantage of this kind of study. The purpose of the cohort study is to test the causal hypothesis and evaluate of preventive effectiveness, study the natural history of disease, and monitor the safety or efficacy of drugs or technologies. This study published in 2019 on RBM Online was to test for causal hypothesis example. It was a prospective cohort study to confirm whether anxiety and depression in early pregnancy would increase the risk of preterm birth. This is an example of evaluating the treatment or prevention. It is a retrospective cohort. The result indicated that patients undergoing ART therapy had a higher live birth rate through surrogacy than non-surrogacy, especially in patients with uterine factor infertility. But it should be taken into caution that surrogacy is not allowed by relevant laws and regulations in our country. This example is to study the natural history of physiological process. It demonstrated that ART-associated DNA methylation changes in newborns are restored in their adulthood. The last example is to monitor the safety of the technology. It was published in BMC Medicine 2018. The result indicated that fresh embryo transfer offspring grow faster than both frozen embryo transfer offspring and nature-conceived counterparts. Cohort study have several advantages. The outcome rates of exposure group and the control group can be obtained directly, and the RR and AR can be calculated directly subsequently. The ability to test the hypothesis is stronger because the exposure occurred before the outcome. The data collected were complete and reliable, and there was no memory bias. The sample size is usually large, and the results are relatively stable. It is helpful to understand the natural history of the outcome and to analyze the relationship between one cause and many effects. Prognosis, treat options, and individualized treatment studies can be performed. Baseline rates are understood so that control, prevention, and health promotion programs can be developed and implemented. Yet there are still limitations. Cohort studies are not appropriate for etiological studies of low prevalence diseases. It is easy to produce lots of follow-up bias. The research is expensive and time-consuming should be considered. During the follow-up, the unknown variable introduced into the population or the change of the known variable in the population can affect the outcome and complicate the analysis. Overall, the platform of cohort study is the carrier of observational studies. It provides targets for experimental study. In cohort, patients were studied according to the strict methodology of design, measurement, and evaluation. Based on it, we could explore the causes, characteristics, and the prognosis of disease, and finally improve the level of diagnosis, treatment, and disease prevention. That's all. Thank you.